Hi friends, good evening. Once again, welcome back to my channel Mogambiga Nursing. Friends, in the previous video, we discussed important and previous year questions. Today, in this video also, I am continuing important and previous year questions. Surely these questions will helpful for your exam preparation. If it is useful for your studies, please share my videos to your friend circle and subscribe my channel and support me. Let's continue the questions. Today's first question. Which vaccine should receive the children who have undergone splenectomy? Our options: option A hepatitis B vaccine, option B pneumococcal vaccine, option C BCG vaccine, option D yellow fever vaccine. Splenectomy means removal of the spleen. Okay, so here after splenectomy, which vaccine should give to the children? Correct answer is option B pneumococcal vaccine. Pneumococcal conjugated vaccine is given to the children after splenectomy. The dose is 0.5 ml and the route is intramuscular IM. Move on to the next question. Which strain is used for BCG vaccine? Our options: option A Edmonton Zagreb strain, option B Oka strain, option C Danish 1331, option D RI27/3 strain. The strain which is used for the preparation of BCG vaccine is Danish 1331. Option C is the correct answer. And the first option, Edmonton Zagreb strain, which is used for the preparation of measles vaccine. And second option, Oka strain, which is used for the preparation of varicella zoster, which cause chickenpox. Okay. And option D, RI27/3 strain, which is used for the preparation of rubella vaccine. BCG vaccine strain is Danish 1331. And the next question is the ideal time to perform postpartum sterilization as per the guidelines of Government of India is. Options: option A from 6 hours to 7 days of delivery, option B from 12 hours to 7 days of delivery, option C from 24 hours to 7 days of delivery, option D within 7 days of delivery. Here the question is, what is the correct time to perform postpartum sterilization? Postpartum sterilization means after the delivery, immediately after the delivery, when we can perform this sterilization. Postpartum sterilization is one of the permanent method of sterilization. So, the correct timing is, as per the Government of India, what is the ideal time? It can perform after the delivery of placenta to 42 days. That is, during the time of postpartum period, we can perform this postpartum sterilization. That is, permanent method of sterilization. Here, the correct answer will come from 24 hours to 7 days of delivery. Option C is the correct answer. And the next question is, a 10-month-old non-immunized child should be given which of the following vaccine? Our options: option A DPT1, OPV1, measles and vitamin A. Option B BCG, DPT1, OPV1, measles and vitamin A. And the next option is BCG, DPT and OPV1. Option D BCG, DPT, OPV1, measles and vitamin A. Here the question is, a non-immunized 10-month-old child will get which of the following vaccine? Okay, till now the baby doesn't get any vaccine. So what are the vaccines we can give to the baby? Firstly, we will give at birth, we will give BCG. Then among this option, DPT we will give. Then OPV we will give. Then measles vaccine at 9 months we will give. That also we can give. And vitamin A we can give. So the correct answer is option B. BCG, DPT1, OPV1, measles and vitamin A. And the next question is, lack of oxygen in the bloodstream is called. Options: option A asphyxia, option B anoxemia, option C cyanosis, option D anoxia. Our first option, asphyxia. Asphyxia, the word meaning is suffocation. Because of decreased oxygen content in the body, the patient may experience suffocation, that is asphyxia. And cyanosis means bluish discoloration of the body. And the option D anoxia. Anoxia means absence of oxygen in the tissue. So option B anoxemia means lack of oxygen in the bloodstream. The next question is, Guillain sign is most commonly seen in options: option A maxillofacial trauma, option B basilar skull fracture, option C clavicle fracture, option D cervical fracture. Here what is Guillain sign means? It is a bluishing of the palate in the region of the greater palatine arteries. Okay, it is mainly present in mid-facial fracture or maxillofacial fracture. So here the correct answer will come option A, maxillofacial trauma or maxillofacial fracture. And the next question is, antibiotic prophylaxis before dental procedure is mainly given for the prevention of. Our options: option A, surgical site infection; option B, infective endocarditis; option C, GI infection; option D, ear infection. Our question is, why antibiotic prophylaxis is given before dental procedure? It is mainly for the prevention of infective endocarditis. Option B is the correct answer. And the next question is, most common cause of urinary tract infection is. Options: option A, E. coli; option B, staphylococcus; option C, streptococcus; option D, pneumococcus. The common causative organism of UTI is E. coli. Option A is the correct answer. And the next question is, according to WHO, surgical site infections are infection that occurs at surgical site within. Options: option A, 7 days; option B, 15 days; option C, 30 days; option D, 42 days. According to WHO, the surgical site infections occurs within. Mainly the surgical site infection on the surgical area occurs within 30 days. Option C is the correct answer. Within 1 month. And the next question is, the most common complication of respiratory system after abdominal surgery is. Options: option A, bronchitis; option B, emphysema; option C, atelectasis; option D, pneumonia. Which is the most common complication of respiratory complication after abdominal surgery? And the correct answer is, it is atelectasis. Option C is the correct answer, atelectasis or collapse of the lung. Move on to the next question. Mission Indradhanush was started in. Options: option 25 December 2014, option B 25 December 2017, option C 30 December 2018, option D 25 December 2019. Mission Indradhanush is a vaccination program. It mainly aims to give vaccine for 7 killer diseases. The 7 killer diseases include measles, diphtheria, pertussis, tetanus, polio, tuberculosis and hepatitis B. And this program, Mission Indradhanush program, was started in the year 2014, that is 25 December 2014. Option A is the correct answer. And the next question is, casus nucleus is seen in deficiency of which vitamins? Options: option A, vitamin A; option B, vitamin B6; option C, vitamin B3; option D, vitamin D. Casus nucleus means it is a hyperpigmented scaly lesions which is present around the neck. It is mainly due to the deficiency of niacin. Niacin is vitamin B3. So here the correct answer is option C. And the next question is, most cost effective family planning method is. Our options: option A, vasectomy; option B, tubectomy; option C, oral pills; option D, copper T. Our question is, which family planning method is cost effective? Cost effective means less cost or not that much costly. Okay. Among this option, vasectomy is less cost. Remaining tubectomy is a surgical procedure. It need to stay at hospital. And oral pills also costly. Every month has to take oral pills, so it is costly. And copper T also costly. It is OPD procedure also, then it is costly than vasectomy. Vasectomy is a male sterilization procedure. It can do in OPD basis, so it is less cost or cost effective method of family planning. And the next question is, the postnatal period extend up to. Options: option 2 weeks, option B 6 weeks, option C 4 weeks, option D 3 weeks. Postnatal period means the period which is after the delivery. So it is extend up to 6 weeks or 42 days. Option B is the correct answer. And the next question is, an unconscious patient is brought to the emergency room after a road traffic accident. Which of the following is the priority intervention in the patient? Options: option A, assess for level of consciousness. Option B, assess vital signs. Option C, airway management. Option D, management of bleeding. Here the question is, an unconscious patient is brought to the emergency department after RTA. So question itself, it is there, patient is unconscious. So no need to check the conscious level of the patient. So that is not correct. Okay. So what is the priority nursing intervention, or what we will do as a nurse? What we will do first? We will check. We will do the airway management. Option C is the correct answer. Airway management is the first priority for an unconscious patient. So option C is the correct answer. Move on to the next question. Which of the following sign is seen in pancreatitis? Options: option A, Kerning sign. Option B, Murphy sign. Option C, Cullen sign. Option D, Source sign. And the correct answer is, it is option C, Cullen sign. And the next question is, following delivery, nurse suspect atonic PPH in the client. Which among the following is the priority nursing intervention? Options: option A, massage the uterus. Option B, administer 10 unit of oxytocin. Option C, administer ergometrin. Option D, report to the doctor. Here the question is, immediately after delivery or following delivery, the nurse noticed that there may be atonic PPH. PPH means postpartum hemorrhage. Which is the priority nursing action? And the correct answer is, it is option A, massage the uterus. And the next question is, Asperger's syndrome is a options. It is a metabolic disorder. Option B, degenerative disorder. Option C, neuromuscular disorder. And option D, developmental delay. Asperger's syndrome is a developmental disorder. It is a developmental delay. Option D is the correct answer. And the next question is, DEMPA or DMPA is an injectable contraception which is given every. Options: option A, 2 weeks. Option B, every month. Option C, 2 months. Option D, 3 months. DMPA, DEMPA means depot metroxyprogesterone acetate, which is an injectable contraceptive method, and it is given deep IM, okay, for every 3 months. Option D is the correct answer. Move on to the next question. Test perception of a baby develops at. Options: option A, at birth. Option B, 6 months. Option C, 3 months. Option D, 8 months. Test perception will develops at birth. Option A is the correct answer. So friends, here we discussed important and previous year questions. If it is useful for your studies, don't forget to share my videos to your friend circle.